And we're live. Welcome to Talking Tuesdays with the Starch Queens. I'm Jeanne Schumacher. I'm the Queen of Diamonds. And my partner is Nancy Matthews. She's the Queen of Hearts. And together, we're the Starch Queens. And our lifestyle and weight loss program is online. This is where we provide coaching, recipes, and educational program that helps everybody find weight loss success and healing. And we teach about what we call the trifecta approach. That's where you have to change what goes in. That's the food and drink. You have to change what goes on. That's the environmental, the personal care products, the cleaning products you're using in your house. And then you have to exercise. You just can't get around that. So you can find our program at sqweightloss.com. Check out our resources at starchqueens.net. And do subscribe to our YouTube channel, Starch Queens. And tonight we have a special guest, Dr. David Duniaef. And he...
The Queen of Spades.
Queen? No. Wouldn't that be the king? The king. The king.
Look, this is the 2000s. I can be Queen of Spades.
You could.
It's fine. I'm fitting right in. Okay, I'm just the king of all suits.
Okay, there you go. I like it. So he's an internist specializing in lifestyle medicine. His focus is on prevention and the treatment of chronic diseases through nutrition, fitness, and stress management. His website is medicalcompassmd.com. And
if you wouldn't mind me just adding, it's prevention and reversal of chronic disease. Reversal is very important.
It is. Totally. And our topic focus today is the continuing conversation of heart disease. We had a great conversation before, so we're just picking kind of right up where we left off. But first, we're going to talk a little bit about a wonderful conference that we went to. It was at the Montefiore last October 11th?
6th. October 6th.
Close enough.
Yeah.
It's going to be October, that's it. It's October 11th for 2019. So it's already on the calendar for the third annual Montefiore conference. But take it away, Doc. Share our recap.
Well, before I recap what the conference was, I'd like to comment about what heart disease is and why it's important. I think that's a good way to start, and then we'll go into the conference.
All right.
So heart disease is an umbrella term. It can mean coronary artery disease, it can mean valvular disease, it can mean atrial fibrillation, it can be arrhythmias, and on and on and on. But what we're talking about here today is coronary artery disease, and that's a smaller segment of heart disease. So we don't want to just say heart disease, we want to say coronary artery disease. And what does that mean? That means that there's potentially atherosclerosis or plaques in the artery that cause narrowing and potentially clogging of the arteries. And this is what is called coronary artery disease. And what's interesting about that is you define coronary artery disease as something that narrows the artery or clogs the artery, but really we all have coronary artery disease to some degree, starting at about age, if you listen to Dr. Michael Greger, he'll say age 11, but it starts around 18, 20 that we start to get these plaques that build up. So that it's not just having narrowing, because all of us have some atherogenic or plaque buildup in our arteries. Can it be detected? Well, maybe not. But the ones that can't be detected, the ones less than 40 or 30%, are the ones that actually kill us. Ooh. So we want to be very aware of the fact that if we go to a cardiologist and we get a test, we get echocardiogram, and we get stress tests, and we get even a catheter where they stick a needle into your femoral artery and they go up and they go into your heart. And that catheter still can't see about a 30-40% plaque if it's smaller than 30%. And those are the unstable or immature plaques that actually can kill us. And they can cause heart attacks. And they can also cause strokes. So we want to just define heart disease. In fact, really all of us above the age of like 25 having heart disease and having coronary artery disease specifically. So we don't want to leave out that population. Don't think because you got a healthy diagnosis, you're not having problems with atherosclerosis or plaques in your arteries just because it isn't detectable on a stress test or on a catheterization or anything else.
That was an example that Caldwell Esselstyn gave because one of his peers who was in total, good health. His blood work was fine. He had no issues. He passed stress tests. And then he had a heart attack.
Right. So let me give you the speakers at the Montefiore conference. Were amazing. Right. Amazing. And the lineup included Dr. Caldwell Esselstyn, who's gone by Essie and has done some wonderful studies and has shown in 2 really good studies, one smaller, one larger, but the one smaller had a duration of 12 plus years and has shown that you wouldn't get a heart attack if you changed your lifestyle. And then there was another heavy hitter, Dr. Kim Williams.
Oh my God.
Who was the past president of the American College of Cardiology. And he is a vegan. And he has been trying to convert more and more cardiologists to become vegan. And he highlighted one of the great studies, and that's the Adventist Health Study 2. And that compared, say, a whole foods plant-based diet to the standard American diet, because we know that does much better with a whole foods plant-based diet. But basically delineating out a whole foods plant-based diet that's without animal protein, one that added in fish, one that adds in vegetarian, so it adds in eggs and cheese, and one that eats meat. And what we see time and time again is that cardiovascular disease risk goes way down the less you eat animal protein. It points out that insulin is atherogenic. So in other words, people who are on insulin who have diabetes are at increased risk of cardiovascular disease because they're taking this insulin. They're pumping up their bodies. And when you look at the blood levels of people who inject insulin, it's tremendously high. So no wonder diabetes patients are at higher risk for coronary artery disease.
Didn't he talk about also in that they looked at people with diabetes, and there was one group that had almost like this genetic component to it. The other group was able to lose weight and reduce their diabetes much easier than the other group. And they found out that there was a genetic piece to this component for these people and it's like the people who are the addicts, that the drug addicts.
Right.
Was that him?
I'm not sure who mentioned it, but yeah, it is an interesting segment. So anyway, let me continue with just very quickly mentioning Dr. Kim Williams had talked also about healthy vegan versus unhealthy vegan study. And that was very important. And we've mentioned this before. If you take people who eat meat, they have an increased risk of heart disease or coronary artery disease. And then you look at the vegans or the whole food plant-based people, and you see that the risk is reduced. But if you delineate out between healthy and unhealthy plant-based people, you see that the unhealthy people are just as bad as the people who eat meat. So that's an important point to make sure people understand that it's not about just avoiding animal protein. It's much more than that, and it's all about the whole foods plant-based aspect of it. What I found interesting also from Dr. Kim Williams is that heart disease is still the leading cause of death, number one, and it's the 100th anniversary of this idea that it's the number one cause of death. The trend is it was going down and down and down with the number of deaths. Now it's stalled and started to go back up. And the reason for that is that people think it's the obesity and the diabetes epidemics that are increasing that. But interestingly, at the same time, there was just a survey done about people who eat fast food. About 37% are eating fast food on a regular basis for either mostly lunch or dinner. Correct. And so, it's very interesting. TMAO, which is called trimethylamine N-oxide. It can be related to producing this in your liver, where it gets oxidized in your liver, but bacteria in your gut can bring in the TMA. So before it gets oxidized to TMAO, where it's dangerous, it is oxidized and brought in by the bacteria. The bacteria have the TMAO, and that only occurs in people who eat animal protein. And most Americans, 75% of their protein comes from animals. When you give people who don't eat meat carnitine, in supplement form, they actually can then have the TMA in their guts, which then can be converted to TMAO. And what's the importance of TMAO, besides me saying it over and over again, sounding like a cool word?
I'm glad you asked.
The importance of it is it's atherogenic. It produces plaques in your arteries. And it also increases your risk of chronic kidney disease. And many heart failure patients and many patients who have heart disease die of kidney disease. 6 out of 10, according to the statistics.
That's not okay.
That is totally not.
That's just not okay.
Right. So I thought that we would just bring that up. And it not only causes atherosclerosis, the TMAO, but it also causes platelet aggregation. So platelet aggregation plays a role with the stickiness of the clot, creating more of a clot basis. You think to yourself, well, it's red meat, right? Red meat's always bad. And yes, red meat's bad. But then fish can also produce this TMAO aspect in your gut. And this is really dangerous. If you look
at it at a macronutrient level, it's basically the same. Whether it's, the fish, use it to swim or to fly or to run, whatever the muscle's doing, it's still basically the same thing.
Right. And then we go on to T. Colin Campbell, who needs no introduction, with the China study. And when he was talking about the fact that there was a recent fish oil study that showed, they used 10 randomized controlled trials, that showed there was really no benefit in primary prevention with fish oil. Now, there's a new study that has been published that shows that if you use fish oil in diabetes patients with heart disease, and you use very high levels of about 4 grams, you can reduce the risk of death by about 25%. And then there's the risk of bleed from fish oil also. When you get above 3 grams, it becomes higher and higher. So you got to be careful about that. But it was really interesting about how fish oil for primary prevention is really not that valuable. So anyway, that basically encapsulates what we learned from Montefiore. I hope I didn't suck up too much time with that.
Oh my God, it was an amazing conference.
It was an amazing conference. We had heavy hitters.
I want to say real quick too, Dr. Duniaef, what is your takeaway on fish oil supplementation? I mean, the actual oil, because everything that I've read and that we hear about the actual fish oil, it's rancid, it's full of mercury, dioxide. In reading Esselstyn's book, My Beef with Meat, he talks in great detail about the very poor quality of fish oil.
I can't really speak to the poor quality because there are some companies that have supplements that are very good. And so I can't necessarily speak to it because there are some really good companies. And when I've given fish oil to people, I don't see a tremendous effect, especially in heart disease. So maybe in the studies there are suggestions, but I don't tend to see.
So,
go ahead.
How about the fact that would fish oil be equivalent to ground flaxseed oil? Because fish oil is animal-based, so it's got that against it. But like for women, that they have to take an omega-3 fatty acid. We all should. We've learned that the omega-3 fatty acid from ground flax really improves overall breast health.
Okay.
Couldn't you get the DHA from algae? I mean,
yes, you could get the DHA from algae.
Wouldn't that be a better source than the fish oil?
No, it's not a better source because we don't absorb algae very well. So frankly, it's not a better source. But having said that, and I just wrote an article about this, omega-3 to omega-6, we worry about getting enough omega-3s. It's really not about getting enough omega-3s. It's really about getting a lower ratio of omega-6 to omega-3. Right now, with the meat-eating population and the standard American diet, the ratio is about 20-1, omega-6 to omega-3. And omega-6, and omega-6 tends to be inflammatory. And you want to bring that ratio down to about 4-1. But it used to be 1-1 many, many thousands of years ago, and at least we think. And we want to get it down to at least 4-1. And by being plant-based, whole food plant-based, and not eating much or any animal protein, you can bring that ratio right down so you can bring the inflammation down. So don't worry about the omega-3s, are we getting enough? Worry more about the ratio. And the ratio, the healthier people are the people who are whole foods plant-based, demonstrated by the Adventist Health Study 2, where they did much better and they lived longer. You want to worry more about the ratio than you do about the omegas. And as far as, I just want to clarify something. Flaxseed oil is dangerous. Flaxseed oil without lignans is dangerous. It can increase the risk potentially of prostate and breast cancer. So you don't want flaxseed oil, you want flaxseed. You want ground flaxseed because you cannot digest flaxseed. But the problem is when we do have flaxseed, men especially can't convert. We can get ALA, but we can't get, well, we can get small amounts of EPA, but men can't get any DHA from flaxseed.
Really?
But I wouldn't worry about taking omega-3s. And as far as measuring omega-3s, there's no labs that are necessarily standardized to the level where New York State will accept it. So I was sitting in a presentation, they were doing it on omegas, and I was like, oh great, so how can I measure it? And they looked at my badge and they said, oh, you're a doctor from New York? And I said, yes. They said, then you can't do it. And so I said, I just sat through a 90-minute presentation and there's nothing I can do? And they said, yes. So the standardization for measuring for omega-3s is not great.
Wow, mind blown. Absolutely mind blown.
Yes, isn't it? It's
mind blowing. I mean, this goes to show you that we don't know everything.
Right, and we also can't depend on a supplement.
Right,
we should be depending on food.
Exactly, 100%.
So what is it that you would recommend for the omega-3 to omega-6?
DHA EPA ratio.
Well, what I would recommend is, you want to be careful because DHA is atherogenic, can increase plaques. So it's not as simple as that. EPA doesn't, but DHA can actually increase plaques. So you don't want to go overboard with DHA. You want to basically get what the food you're getting. The safest way to do this is to cut out animal protein and to reduce the inflammation as much as possible, and to increase dark green leafy vegetables, and to get the endothelial functioning working really well so that there's a lot of nitric oxide so that you get vasodilation so you don't have the problem with atherogenic problems where you have narrowing of the arteries and you have the clots and you have the platelet aggregation. You want to avoid that, and by reducing the inflammation, and one of the big factors in inflammatory aspects is animal protein, especially red meat and processed meats.
So I want to just recap real quick, Dr. Duniaef, because I want to make it very clear because this is very mind-blowing. So obviously, number one, we want to eliminate animal products to eliminate the inflammation. And we want to get as much as can of our omega-3 fatty acids from a plant-based source. Now, we have people that watch our program that are new to plant-based living and lifestyle, and they are still, like I was 6 years ago and Jeanne 7 or 8 years ago, we were still really on the supplement roller coaster. So if a person's not eating 100% plant-based or is, between that and a little bit of meat here and there, is there a supplement that you recommend that has the right 1-to-1 ratio that would be beneficial, or is it just better to not take anything?
It's better to not take anything.
That's what I was. That's what my
and also, because like I said, unhealthy vegan diets have tremendous inflammation. I had a roommate in medical school who was vegan, who was eating buffalo wings that were made from tofu. Yeah. And that's inflammatory beyond inflammatory. So, but you need to really do a lot of fruits, vegetables, grains, legumes, beans. All of this plays a tremendous role in reducing your inflammation. And the higher the fiber goes, the better you do as well.
Wow. So we have a question from Peggy Schneider Foster. And I really like this question because it is so rampant across the United States with regards to men. So Peggy's asking, could erectile dysfunction be a serious warning for heart disease?
Absolutely. Most of erectile dysfunction that occurs in men, not in women, because women don't have erectile dysfunction, I just want to clarify.
Thank you for clarifying that.
I didn't know.
Well, we have gender fluid. We want to be very careful in what we're saying.
That's right.
But as far as it goes with erectile dysfunction, most of erectile dysfunction is due to atherogenesis or atherogenic aspects, where it's a sign that you're having too many plaques in your arteries. Sometimes it can be caused by a problem where you have a low back injury and it hits a nerve, and other aspects of paraplegic, or there's all these other aspects. But the largest segment is an indicator that it's related to atherogenesis and what we call vasculopath. We got rid of that term, but vasculopath means that we have plaques in our arteries, all the way through our arteries. We don't just choose, the heart. We don't just choose the
hands, arms, legs.
Right. We don't choose that. I mean, even the genitals for men, it's there. It's there. I mean, it's very important, and it's a good indicator. And if you don't have an injury, most likely it's atherogenesis or atherogenic plaques. I mean, it's the buildup of plaques that's causing the erectile dysfunction. So if you reverse that with a plant-based, whole foods, plant-based approach, you can actually get functioning of your penis back to an erection. And that is a wonderful thing. And the funny thing is, when I'm talking to patients, they talk to me about the heart disease, they talk to me about the diabetes, they talk to me about the cholesterol, the hypertension, they talk to me about all different things. But then at the end they say, doctor, but I'm really here for one thing. And I say, what's that? And they say, the erectile dysfunction. And I say, you didn't put that down on the form. And they say, no, but I feel really good about mentioning it to you now. Can you do something about it? And I said, absolutely. And they get very excited, whatever the reason. Go ahead.
Yeah. And if my husband were here tonight, he'd be the first one to go, yep, it works.
Yeah.
Right.
Yeah. You know, it's really unfortunate because this is really never talked about in society as a whole. I mean, it wasn't until I started learning about plant-based nutrition and learning from when I got my certificate in plant-based nutrition from T. Colin Campbell, is that erectile dysfunction is, like Jeanne always puts it, the canary in the coal mine. That's,
it's a flagpole. I mean, you get to see that it doesn't function. I'm a doctor. I can do anything I want. That's the great thing about it. And this person, a couple of people, this is not just one, but several people have opened up to me and said, I feel so much better telling you because it feels so comfortable to talk to you about this.
Yeah. Well, it's, we're adults, and this is something that affects both men and women because of our, it's something I've shared with the world that my father suffered from severe heart disease. He had 2 open heart surgeries, 11 bypasses. And my mom told me that he had erectile dysfunction. And I was like, la, 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 la. I don't want to hear that, Mom. No, thank you.
Your mother said that?
Yes. I'm like, no, don't tell me these things, Mom. But now I know that
it was you.
I don't know, 30s. I was, 40s, somewhere in there. And, I never knew. I just thought, he's just old, I mean, he's just old and sick. But it really is, the issue was very prevalent.
Prominent. I mean, it's sad.
Yeah.
It's sad
really
because
sad,
people think they can't do anything. Right.
So Nancy, we've got a few more questions. Why don't you?
I know. Let's go ahead and.
Helen asks, she says, all this talk about clogged circulatory, I think dry brushing can help.
I've never heard of that.
I've never heard of that. Have you?
No.
After I shower, it's wet, so I
Stop it. I knew there's going to be some comment in there. I've never heard of dry brushing.
I don't know what that means.
Dry brushing is a homeopathic activity that you actually take a dry brush, like if this was a brush, and you literally brush the exterior of your skin. So it is not, I don't want to discount the importance of dry brushing. I think it has got some element of quality for skin care, but I don't see how that's not going to help break any clogged arteries or plaques down. It's impossible. That has to come from nutrition inside of you.
Absolutely. From the inside out.
Statins, yes or no?
What I saw was, do statins prevent heart disease, or do they protect us from heart disease? And the only reason I'm reading the question is because I think it's a really great question. The answer is, it's very interesting because T. Colin Campbell mentioned in his presentation, and I don't know if you remember, Jeanne, but that statins in primary prevention, that means people who do not have coronary artery disease presently, but that could get it, it reduces the risk of death with outcomes data, mortality, death, whichever one you want to use, by a whopping 9%. In other words, it doesn't really reduce the risk of much at all. And I saw on the internet a study with 18%, then I saw a couple of studies that say it's controversial and it may not do much at all for primary prevention to reduce the risk of mortality. And the thing is, there was a study showing that people who take statins eat worse. So what are statins? They're cholesterol lowering. They're cholesterol lowering drugs. And what's the importance of statins, though? Let's not rule out the importance of statins. Statins not just reduce cholesterol, but they reduce inflammation, and they reduce something called C-Reactive protein. And you want to get that below 2. The range for average is 1 to 3. Ideally, you want to get it optimal to less than 1. Guess what also reduces it? A whole foods plant-based diet can reduce it to almost nothing. So you can reduce the cholesterol and you can reduce the inflammation, and it really protects you. And when Dr. Caldwell Esselstyn was doing his study, what he used was reducing the cholesterol to less than 150, but really reducing the LDL is more important than the bad cholesterol. And inflammation, though, is also an important factor. So we can reduce inflammation, and I see it time and time again, that we can reduce inflammation over and over and over. And it's amazing how as the nutrient level goes up, the inflammation goes down. It's an inverse relationship. And it's not just by stopping the animal protein, but it's by getting the nutrient levels up. So you can still eat a little bit of animal protein, like I said, because I don't want to intimidate people and say you have to be not eating any animal protein. But the best is not to, but you can still eat a little bit of animal protein, and you get the inflammation down to almost nothing. And the risk of heart attack goes down to almost nothing, or what Caldwell Esselstyn says, basically heart attack proof. Well, you can't say heart attack proof, but it's pretty close to that. In the CDC has now, and this just came out by, I really like her articles, Jane Brody in the New York Times. Have you heard of her?
Mm-hmm.
Okay, so she writes an article once a week, and she's been doing this for years, and she writes it on health. And she wrote about the CDC has now put out a challenge to reduce heart disease by 1 million people. And they talk about how reducing sodium is very important, because when we have sodium, we're having about 4,000 milligrams of sodium. We're having either 4 grams or 4,000 milligrams. It's really 3,900 or so. And what we should be having for most people is no more than 2,500. And for people with cardiovascular disease or coronary artery disease, it should be 1,500 or fewer. But we're missing the point here. It doesn't really matter what the number is. It's where it comes from to begin with. You don't want it to be really high, but you want it to come from plants. And plants have a lot of sodium. They have a lot of salt, believe it or not, in greens themselves. So if you eat a lot of dark leafy greens, you can get about 800 to 900 milligrams of sodium right there. And it's wonderful because it's balanced out. Now, when you do this, this reduces the risk of blood pressure and can reduce the risk of heart disease. But there's a study called the PURE trial. The PURE trial, there's 3 different parts to the PURE trial. And I mentioned one before, but this one I'm mentioning is about comparing high sodium versus low sodium and how do you do on that. And this is a study that is observational, and it looks at 18 different countries. And what they found was in China, high sodium played a role in blood pressure, but nobody else had the problem because they didn't have such a high level. But the problem with the study is that they took patients, or they took the population, and there was such variability in each country that they took the median number from each country and said, okay, this is what China has, this is what the US has, this is what England has, but you can't do that. And by definition, because there's so much variability, you've got to go with the variability. That's like saying in the US, we eat more fast food than they do in the UK by saying, okay, let's look at the median. But that doesn't necessarily tell you that more people do. It just tells you what the middle number is.
Right. That's amazing.
Part of it is they also gave lip service to fruits, vegetables, and whole grains, which I thought was wonderful. And they also talked about how we need more exercise. And they also talked about, obviously, reducing tobacco smoke. Believe it or not, it's still going on.
Oh, in China. Oh.
I mean, they talked about it as part of the U.S. as well. So, but it's really interesting. I mean, that's what 2022, it's all about the U.S. reducing it by 1 million heart attack deaths. And this would be an amazing thing.
We have a couple questions, Doctor.
Sure.
We have Fab and Peggy are both asking if you can stop statins abruptly. And Fab also asks, should a person take a specific test showing if there's plaque?
Okay, so great questions.
Yes.
As far as statins go, statins are potentially beneficial. We don't know how much, but for primary prevention, like I said, doesn't look really that great for reducing the risk of death or mortality. And that's what we really want help with. So as far as it goes with stopping your statins, you never stop a drug all of a sudden by yourself. You ask your doctor, you work with your doctor, you partner with your doctor. And if they don't want to partner with you, then you find someone else, another doctor who partners with you. But you do not just stop your statins on your own, because you need to work with your doctor so they know.
Right.
The second thing is, when you look at statins, sometimes I look at patients and I see that their cholesterol is really low and it looks really good, but then I look at their CRP, I look at their inflammation, and it's too high. It's above 2, it's above 3. Above 3 is high, 1 to 3 is average. You don't want to be average, you want to be optimal, like I said, less than 1. But if it's above 2, the Jupiter trial suggests you shouldn't stop the statins. So it's basically, you want to stop the statins gradually. And
well, bring it down with a plant-based diet.
Right, right. And that's what we're talking about here. That's what is all-encompassing. This is about a whole foods, plant-based lifestyle change. If you're not making lifestyle changes, then stopping your statin is scary, because that's not a good thing. That's not, let me repeat, that's not a good thing. And also, when you're on a statin, it doesn't mean you wear a cloak of invincibility where you can't be, can't get through. It means you need to do even better. And you want to get off these statins, because statins have side effects, potentially, of memory issues and increasing the risk of diabetes. And then there's problems with muscle. And they don't necessarily occur, muscle pain. And they don't necessarily occur in the first 6 months or the first year. They can occur many years later. So you want to be very careful. But when you do, you want to wean somebody off a statin.
Well, one of the people that I coached went from, he started plant-based, his cholesterol was 279, and in 3 weeks, it went down to 99. And so his doctor said, I think we need to take you off some of these medications and reduce some of them. So he had the evidence to show him that his cholesterol had dropped. So now he was able to progressively get him off the medications. So,
yes, and I've seen many times the same thing. I've seen many times how it drops like a rock.
I'm actually a testament to a plant-based lifestyle. My cholesterol when I started was 268. It's now in the low 140s. And one of my reasons to go plant-based was to avoid statins, because the doctor was starting to recommend them. And I said, no way. I saw the side effects my dad experienced with them, like you mentioned earlier, muscle pain, muscle weakness. And I said, no, I'm not going down that road. So it works. Couple questions. Jamie Reese. Excuse me, Jamie, I don't want to pronounce it wrong. Jamie's asking, what about a baby aspirin a day?
That is a great question. And I was going to bring this up as one of my new studies. But there's been so many new studies I've been bringing up that I think that we're getting, but here's the thing.
We haven't even gotten to any of the questions on the agenda. You know that. This is going to
well, that's what,
he's going to come back.
Right. But this is a huge topic. When you have a disease, a chronic disease, coronary artery disease, let me clarify, not just heart disease, the umbrella term, but coronary artery disease, which we are all afflicted with to some degree. Don't be fooled. However,
baby aspirin. Let's get back on topic.
Right. However, as far as baby aspirin goes, all right, so let's say for prevention, there have been recent studies that show that a baby aspirin in those who weigh less than 154 pounds can reduce the risk of a cardiovascular event by about 23%. So that means 1 out of 5 events will be prevented. So you can have 4 strokes and 1's free. So one, you don't have. So you want to be very careful with that. However, if you weigh more than 154 pounds, it can actually increase your risk of cardiovascular disease if you're taking a baby aspirin.
They were talking about that at the conference.
Right. And so you should be taking an adult aspirin between 325 and 500. But the scary part about that is your increased risk exponentially of bleed goes way up. That's why we don't typically do that. And your risk of bleed goes up and up and up and up and up. And so every time you double, it's not like the risk goes up, it goes up more and more and more. So you want to be careful because you don't want a gut bleed where it's bleeding in your abdomen. You don't want, a lot of people have hemorrhoids. You don't want, everybody has hemorrhoids, but you don't want your hemorrhoids to get inflamed. But worse than that is hemorrhagic stroke. Hemorrhagic stroke is bleeding in the brain. Bleeding in the brain, we can't necessarily find it until there's too much pressure. Whereas an atherogenic stroke or a clot, you can find it, but you can't necessarily find where the source of the bleed is. So that's the scary part about aspirin. And for people who are 75 and over, there's now a study suggesting they don't need a baby aspirin if it's primary prevention. When you do have heart disease, it's not a bad thing to be on some kind of blood thinner, and that can be an antiplatelet, and that's aspirin. So it's a different story when you're talking about secondary prevention when you already have heart disease. So that could be beneficial.
Wow. That's great to know. I mean, those are the things that you don't hear about. You don't hear about those. And we have another great question that I want to squeeze in here. We've got a couple more from Peggy, but this is a good one as it relates to a plant-based lifestyle. Howard Bielich has been plant-based now. Let's see, I'm going to just read the question. Howard Bielich says, all my numbers are good except my C-reactive protein is still high. Whole food, plant-based, no salt, oil, or sugar for over a year. What's up with that? And Howard just recently reached 100-pound weight loss. Just celebrated that. 68 years old, but C-reactive protein is not coming down.
Well, congratulations to Howard for 100-pound weight loss. That's a phenomenal.
Amazing.
But let me give you a perspective.
How much weight does Howard still have to lose?
Well, if you were to, I can't show you guys his picture right now. So Howard, let us know. Post how many more pounds you think you need to lose, Howard. I'm going to say it's not much. He's very thin.
Okay.
So, but let me get to the point here, which is that losing weight is a wonderful thing. There's absolute benefit, but you want to make sure you're losing fat pounds, obviously, and not just water weight and muscle weight. And you want to be careful of that. But 100 pounds, you can't be losing just water weight and muscle weight.
No,
right.
He has lost.
We know that. Right. No, I understand. Okay. So, but losing weight isn't necessarily the answer to everything. So in other words, let me give you an example. I have a patient who did everything I told her to do. This is about her sugars. Her A1C, her 3-month sugar, was 9. Normal is really less than 6 or really 5.6 and lower. She got it. She lost 18 pounds of weight and 12 pounds of fat in the first 6 weeks, which was great. And what did her A1C do? It went from 9 to 9.6. So it went up instead of down. And the reason it went up was that she was doing something where she was having, instead of the steamed vegetables in a Chinese restaurant and the sauce on the side, she was having the sauce swimming, the vegetables swimming in the sauce. So there are different parts that play a role here. But one of the things you want to be careful of is the sugar, salt, and oil, the SOS type thing. But the other thing is you want to make sure you get those nutrient levels up. And the nutrient levels are going back to Dr. Caldwell Esselstyn's ORAC score, or Dr. Joel Fuhrman's ORAC score, or talking about the fact that you want the dark green leafy vegetables. You want to make sure that you're having dark green leafy vegetables as the main part of your meal for every meal, so that you get that nutrient level up. So that's what you want to do. And you want to make sure those basically 3/4 of the meal or 2/3 of the meal that you're getting a lot of dark leafy greens, and also onions, mushrooms, and all those other wonderful vegetables as well. But yes, T-bombs, and that comes from Dr. Joel Fuhrman. Yes, exactly. But you want to make sure you're getting those, and that is so important, and that's going to bring down the inflammation, and that's the inverse relationship with what's going on here.
Well, Howard tells us he weighs 172 pounds now. He's 5'8", and his A1C is 4.9.
That's great.
Yeah.
That's great. That's wonderful.
That's really
That's
good.
Wonderful. That's wonderful.
To know what it was before. So that's,
right.
So Howard, greens, and more greens.
Dark leafy greens.
Dark leafy green greens.
Exactly.
Can you eat too much kale, Dr. Duniaef? That's a question.
I would assume it's possible if you stuffed it in every orifice, but there has never been a case of somebody, right, exactly. There has never been, right, because I don't want to say no, because you never know that somebody's going to go out and swamp themselves, but there's never been a case of someone who's eaten too much kale. You can eat tremendous amounts of kale.
Well, so Essie talks about one of his patients that had, the wife took him serious, because he basically says 6 times a day to have the dark leafy greens, especially kale. And she took him at his word. And 6 times a day, she was, basically spoon feeding it to her husband. And within his progress was absolutely remarkable. In terms of, Essie commented and said he had never seen anybody change that quickly, that fast.
Right. It's amazing how fast the body will heal. So Fab, just for an example for today for my lunch, the big containers of spinach at Costco, and then there's the half containers that you can get of baby kale from the grocery store. I ate an entire one of those today for lunch, plus 2 or 3 big handfuls of the
big one or the little one?
The half one, the half container. I ate the whole thing.
Did you eat the container?
No, I didn't eat the container.
Oh, okay,
There's
good.
no fiber in there, doctor. So.
Oh, well, you never know. It might be made of recycled fiber. I don't know.
No.
Actually, I felt terrible about throwing it away.
Well, my husband just was reading an article, I think it was from the New York Times. They were talking about how much plastic is in the urine.
Yes.
Terrible.
Yes, but that doesn't necessarily mean much. Let's just veer off for 1 second.
I sense trouble.
President of the American Cancer Society said we should focus on what we can control with our health, rather than worry about the 80,000 plus chemicals coming at us every day. And so the focus should be on the whole foods, plant-based diet. Don't worry about all the little details. Now, having said that, somebody may bring up, and having mentioned this and opening a can of worms, and we can do another session on cancer, but with cancer, there was a study that showed a 25% reduction in potentially death with organic foods versus non-organic. Before you jump on the bandwagon, though, let me say this and preface it with this. An absolute reduction was 0.6%. So there wasn't enough population, or maybe there was too much, but there wasn't, the percentage was so small of 0.6%, that worrying about all these different details of organic or non-organic, yes, it's better to buy organic, but is it better to break the bank? No. Is it better to eat dark green leafy vegetables when they're in front of you, whether it's organic or not? Yes. And many studies have shown tremendous benefit. So don't let a study like that ruin it for you by saying,
Exactly.
okay, 0.6% absolute reduction, which is nothing.
No, it's best to always eat whole food, plant-based, commercially grown. If you can do organic, great. I love to support organic farming. It's very important and dear to my heart. But
it's very expensive and it's also hard to get.
Well, not in California. Fortunately for me in California, it's everywhere and it's abundant. But
Okay.
And it's not as expensive. But you guys on the East Coast is a different story. So, but eat the plants regardless. And
Right.
we always recommend follow the EWG's Dirty Dozen and Clean 15, and you're good to go. I mean, that's where we think that it is. But commercially grown plants is better than animal-based proteins. And
if we didn't have commercially grown, we'd have a shortage of food.
This is a really good question from one of our Starch Queens members, Debbie Osborne Lewis. Doctor, this is a good question. Doesn't a person on blood thinner need to be careful with the kale, dark greens, etc., due to vitamin K?
Okay, so that's a great question.
It is.
Interestingly, I double as a double agent. And what I mean by that is I used to be a pharmaceutical rep selling warfarin, Coumadin for a year. So I know a lot about the blood thinners. Now, as far as the blood thinners go, it's only warfarin that plays a role. So if you're worried about it, the best way to control it is to switch to, I find Eliquis tends to be better than Xarelto. But that's just my personal opinion. I've seen people with more bleed with Xarelto than Eliquis. And supposedly the factor 10A inhibitors, which are different from the cascade that warfarin or Coumadin is working from, now has a reversal drug. So that was the problem before. They didn't have a reversal drug. So if you had a bleed, you just had to ride it out. If you are on warfarin, what you need to do is check your INR, and you need to keep changing your amount of drug. And I had this patient as a badge of honor. He kept going up on his Coumadin because it meant that he was eating more dark leafy green vegetables. And I loved it because it meant that he couldn't eat less. He had to keep eating the dark green leafy vegetables, because if he didn't, then he would bleed and he would have to lower the Coumadin, and it could be life-threatening.
I mean, going back to that, you just have to work with your doctor. If you're going to start consuming leafy greens, you just have to work with your doctor to adjust that.
Correct. Correct. There's no, I mean, you can eat the dark green leafy vegetables, and you most certainly should, and you can adjust it with your doctor. And finally, we got to the point where this patient was uncontrolled. In the beginning of the month, he was low. In the end of the month, he was high, except he was eating the same dark green leafy vegetables all along. And so we finally just switched him over to Eliquis. And I'm not saying you have to switch over, but if you have trouble, you can switch over. And I'm not saying one of these drugs is better than the other or whatever, but if you do, then you won't have to worry about the vitamin K factor.
One more question.
You have one more and I have one more, if Dr. D is okay with that.
I think it was Debbie who said, if someone who has memory problems was able to get through a whole food plant-based diet and able to get off their statins, can their memory improve?
Potentially, if it's brought on by the statin, sure. Your memory could improve when you get off the statin, sure. But that may not be the only factor that's related to statins. True. So in other words, let me give you an example. Tinnitus, which is ringing in the ears that nobody knows how to treat.
I have it.
Turns out that B12 may play a role in tinnitus. And if you make sure your B12 levels are high enough, then you may get rid of the ringing in your ears. Or the tinnitus may be caused by congestion, or the tinnitus may be caused by a cold, or whatever it is that's brought it on with sinus issues or something like that. But there's a large segment that's unknown. So you got to be careful about the unknown aspect. But sure, would you like, if you're having memory problems, would you want to get off statins? Absolutely, because you want to take that factor away. Right. You want to take that factor away. So that should be encouraging to get on a whole foods plant-based diet, and that is a great question.
I do want to do a quick recognition for Peggy Schneider Foster. She's telling us that when she started her journey, her CRP was 11. And she's now 3 months on a plant-based, sofa-free, salt, oil, sugar, alcohol, and salt. So and it is now down to 6.3 and still dropping in 3 months from an 11 to a 6.3. That's good.
That's really good. Now, if you do really well, you can drop it by half every month. I've seen with patients that you can drop it by half. I've even seen patients who have dropped it even quicker than that. Good, but this is going in the right direction. And in a couple more months, you'll have the CRP down to where you want it. But believe it or not, the more you increase the load of dark green leafy vegetables, the more you can reduce that CRP even faster and faster. So I'm encouraging it, and I think it's wonderful. I've seen it go down, but usually if people are doing really well, every month you can cut it in half. So 11 could go down to a 5.5, could go down to a 2.75, could go down to a 1 point, and so on and so on and so on. I'm not doing the math anymore.
Good. Well, I do have one last question. I do, because Elena Robinson's asks, anything about KTS? I don't know what KTS is, so I've asked her.
I don't know what KTS is.
So we're not familiar. Sorry, Elena, we're not familiar with the term KTS. Can you quickly share the acronym with us?
Okay. While she's doing that, I just want to say that we have a great agenda because we never got to it. So pop that over because you're coming back in November. So we've already got you on the calendar. I don't remember the date, but it's coming up in November. So we'll start the agenda there.
Or maybe we should do something else and then come back to it or whatever. I don't want to make people just...
Okay. Such a huge, I think you're right. I mean, it's one of the things that is so widespread. It's the #1 killer. We need people to hear about this and hear about all this information.
We could talk about this for a year as our main
topic. And you could also for diabetes, you could also for... I mean, there's a bunch of different topics, high blood pressure. If you just looked at the top 15 killers, you could just talk about that for the rest of your life, basically.
Yeah. And it's really true. I mean, I know it's dear to Jeanne's heart and to mine. It was part of the reason for our journeys and the why of our journey. And so the more that we have you on the show, the more we can dive into these things. We really talked about things that I didn't even know with the DHA, EPA, and the ratio and the 1-to-1. And, these are things that need to be talked about. It's very important that we're giving people up-to-date research like you just did today. I mean, and so that's fantastic. So the more that we can do this, the more informed we'll be.
Right, and be careful with the DHA because, like I said, it can be atherogenic. It can produce plaques. It can do the opposite of what you think.
Yep. One of the things I also want to say is that I really liked what you were saying about your patient answered all these questions and then the root cause he wanted to talk about is erectile dysfunction. And that's one of the things that I've learned through my journey is that you really need to build a relationship with your doctor. It's imperative to be open and honest and not be bashful and not be shy. If you need to go in and say, I have warts on top of warts on my hemorrhoids, you got to own it. You've got to ask these questions, and the doctor isn't a mind reader. I'm just saying, you've got to be open about these things. The doctor is not a mind reader.
No. Let me clarify here. Even more subtly than warts, that would be nice. But even more subtly than those type of things is being open to what you're doing. So in terms of lifestyle, when you say you're eating well, if I ask a patient what they're eating, a lot of times people will tell me exactly what I want to hear. And I will say, okay, now let's talk about what you're not doing or what you've done on the side, because the numbers don't suggest this is the case. Now, they could be wrong, but my experience would say that they're not. So let's talk about what you need to be changing. And they'll sometimes say, oh, I've been sneaking in this, or I'll be sneaking in that, and I'm having candy on the side, or I'm eating late night and I'm having cookies or something like that. But it becomes even less obvious where they have a situation where people will be eating one little treat here and one little treat there, and the treat could be too much oil. And you're saying that's a treat, and it's not a treat. Or they could be eating too many nuts and too many avocado at one time. Or they too much salt. Or they could be eating out too many times and not realize what they're ordering has something in it that they shouldn't, and they need to ask for it on the side so they never have it. But there are...
I went out to one restaurant and I got black bean soup, and I went through the litany. I asked about oil, and vegan, la, 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 la. Oh my God. 1 cup of soup, 8 ounces. I get blood pressure headaches. I'm one of the rare, the people that get them. I didn't even get out to my car. I thought my head was going to split open because I don't eat salt at all. And this had 56, just this 8 ounces had 56% of daily nutritional requirement for salt. I thought my head was going to pop open, like with a, like somebody was hitting me with a sledgehammer and my head was splitting in two. That's how.
Well, you have to eat salt, because if you didn't have some salt, you die.
Yeah, but you have,
so
you have salt. You have salt in the vegetables and things that you're eating.
But you're eating salt. That's still eating sodium.
But you know what I mean.
I understand what you're getting at. You don't have added salt. You don't add salt, and you make sure you're not
wouldn't
having
eat that much salt
and stuff like that.
I wouldn't eat that much salt.
I got it.
In a month. Never mind in 1 cup, in one.
Well, as far as salt goes, I mean, people have different reactions. Some people don't, unfortunately, have a reaction. But, I have things where I get an arrhythmia when I have too much salt. And it is really an awful thing. And I realize that is a really scary thing. Yeah. And some people get swelling in their hands and feet. And so you should watch out for the indicators, the signs of what too much salt is, especially for your body.
Yeah.
And so you want to be very, very careful.
And that's one of the things Nancy and I have, seen as we've on our journey. It's like peeling back the layers of an onion, and we find out how our body's like. She is so caffeine sensitive; she can't have any caffeine in any way, shape, or form. Whereas I'm not as that bad, but for salt, and she can have salt, all the salt she wants. But you run salt by me, like with it, and my blood pressure goes up. I mean, it's crazy. So we're learning, and as you point out, and I love how you say this, every body is different.
Because we all metabolize differently.
Right.
That's what we share with our Starch Queen members as well. And that's why, like Jeanne was saying, as we pull back layers, because no body is the same, we just all have to learn. And this is a whole process. So thank you, Dr. Duniaef, for joining the Starch Queens again this week. We really appreciate it. It's always fun to have you when we know you're coming back in November. And I believe our viewers tonight got a lot to think about.
Yeah, totally.
Well, this was wonderful. This was absolutely wonderfeighty.
Good. It was a great conversation. Thanks for joining. Yeah. If anybody's interested in learning more about the Starch Queens program, check us out at sqweightloss.com. We'd love to have you as part of our program where we can get you heart healthy.
And if anybody's interested in Dr. Duniaef, you can find him at medicalcompassmd.com. And he's an amazing guy. You've got 2 offices, one in Brooklyn and one on Long Island, right?
Right. One in Stony Brook / Setauket, Long Island, and one in Brooklyn. And what I practice, just so you know, is integrative medicine. And I call it integrative medicine because it's a combination of conventional medicine with lifestyle modifications. That includes the whole foods plant-based diet, the nutrient dense, as I call it, the nutrient dense diet on stress and on exercise as well. And the importance of all this is the interaction of what happens with medications as well. Let me just give you one quick example. One of my patients was not following the whole foods plant-based diet the way we'd like. And so I finally capitulated to saying, okay, the internist who is following this patient said, I'm going to put you on a bisphosphonate, a drug that helps with helping the bones, so reducing the risk of fracture. And I finally capitulated to it. But the problem with bisphosphonates is that it's like painting a wall. All you're doing is thickening the bone. When you stop the cycling of bone, it becomes very dangerous because we don't really know what happens. I mean, yes, it reduces the risk to a certain point, but then after a few years, it can then cause atypical fractures. Now, if you're not changing your lifestyle, doing a bisphosphonate may not be a bad idea. So you can't just say, I'm not going to do it. But it's like porcelain. If I thicken porcelain and then I drop it, is it still going to break if it's thicker, reinforced? I'm not putting metal rods in there. I'm just putting in more porcelain. It's still going to break. So anyway, so finally I capitulated. My doctor told me that they know I'm prone to indigestion, so they're going to give me a special drug at night so I won't have the indigestion problem in the morning, because when you take a bisphosphonate for osteoporosis, you have to stand up or sit down, but you can't lie down or anything else. You have to be upright for 30 minutes or more.
Really?
So, and you can take it once a day, or you can take it once a week, or I think it's now up to once a month. So don't think it's every day or something like that if you don't want to. But having said that, the special drug was a proton pump inhibitor. And the proton pump inhibitor, I said, aha, we're not doing this. You know why we're not doing this? Because the proton pump inhibitor increases the risk for fracture.
Oh, wow.
So if we take a proton pump inhibitor and we take a bisphosphonate, we're canceling each other out and we're getting the side effects.
Oh my God.
We're not doing this. We're not, and we found there's a supplement that's beneficial, and I won't go into that detail. But the point of it is, we're not doing this because it negates the effect. And or another example, very quickly, is when you're looking at diabetes patients. There was a study done with beta blockers. Beta blockers are like metoprolol, atenolol, all these beta blockers that the people who like them the most, and I don't know why, tend to be the cardiologists because it's related to the heart. And they're used a lot of times to prevent heart failure. They're used with people who have heart failure to prevent death. I mean, they have a role to be played, right, and especially in heart failure. But there was a study done that showed that people with diabetes, whether they had heart failure or not, beta blockers, and they named specific beta blockers like metoprolol and atenolol, and they said they increased something small called death by 55 to 65%. Right. So this is what I do. This is what I point out. Then I go to the cardiologist and say, do we want to remove them and put them on a calcium channel blocker? Do we want until we can get them off and they do better? But if they're not doing better, at least put them on something that's not going to cause a one-time side effect that they can't return from.
Wow. Yeah. Hello. That's terrible.
But you see how we're going about that.
Yeah, okay. Absolutely. That's a wise approach. We did get what KTS stands for. KTS is Klippel-Trenaunay syndrome. It is a rare vascular disorder that affects one limb of the body, venous malformation, port wine stain, and one limb bigger than the other. So inflammation. I have it on my right leg, and I'm trying a whole food plant-based diet. And then also she asks if you know Dr. Granola. Gangola.
No, I like the granola name better. It was a great name. Send me.
I'm not hungry, okay?
Why don't you, Jeanne? Why don't you email me the name of the disease and I'll take a look and see what we can do and see if there's an aspect to it. Because you don't just look at here's the answer to what I can say about KTS. I don't know about it specifically. However, because I'll tell you straight out, and I won't. But what you can do is you can look at aspects to it. And if it has an inflammatory factor, if it has an atherosclerotic factor, if it has clotting factor, if it has some reason, if it has edema, if it has swelling for some reason that we can understand, then we can potentially address it. And if we can't, then we can still do a whole foods plant-based diet because the side effects won't be negative. But it'll only be better health. But we can look into what the aspects are. We can't say there's a trial that says, oh, yes, KTS does this or does that in the trial because there isn't one.
We have an urgent question based on what Dr. Duniaef just shared with us. Gail, who's in our program, she says, wait, did he just say taking atenolol increases chance of death by 55%? Is that if you're diabetic?
In diabetes patients, correct.
Yes, so the answer
in diabetes patients. So you want to ask, you do not want to stop it. Do not stop it without talking to your either internist or your cardiologist. And most likely, if your cardiologist put it on, you have to have a conversation. I don't care what the study says. You have to have a conversation about it.
You can't just go cold turkey.
No, you can't do cold turkey. That's amazing. I'm so glad that you brought that up, and Gail was able to tune in tonight and watch that. And so, Elena, Dr. Duniaef, and Jeanne will get together on your KTS, but we'll end real quick by saying there is no reason to not go whole food plant-based. Your body's going to heal. Inflammation's going to decrease. So, as far as one specific thing, go ahead, doctor.
Here's the thing. I thought this should end like this.
Okay.
I have a cardiologist who's very good in the community, very good. And a lot of people like him, and he's got that conservative approach not to do things, but he's not plant-based right now. So I'm bringing him on board as a patient of mine to make him plant-based. And that's the way I do it. So let's see how it works. I mean, keep our fingers crossed and see how it does. I invited him and he's accepted. So let's see how he does. However, what he says to patients is, I can do one of two things for you. I can either help you live longer, or I can have you live healthier, feel healthier. Okay? And I said, what's that mean? He said, I can either put you on the medications which have lousy side effects like a beta blocker and cause you to have fatigue, or a calcium channel blocker cause you to have swelling in your ankles and things like that, and you'll potentially live longer, but your health, you'll feel it, and your health will go down and you won't feel as good. Or I cannot give you the drugs and you'll die sooner. And I thought to myself, wow, that's mind-blowing. Why don't we do something called a whole foods plant-based diet, where we can give you longer potential life and a healthier lifespan? Because people don't want to live longer, they want to live healthier. No, they want to live longer if it's healthier, and you want both, because if you live longer and you don't feel pain, why would you want to die? And I end with that.
That's a great ending. Thank you, Dr. Duniaef. Thank you, Jeanne. Thank you, everybody, for joining us. It's been a very special night, as always, with Dr. Duniaef. I always feel like we've helped the world a little bit more, given everybody a little bit more knowledge, and it's a great takeaway this evening. So thank you.
King of suits. Signing off.
King of Spain.
No, king of all suits.
Yeah.
There's only one.
You're the boss.
Right. No. I'm just kidding.
Good night, John.
All right, have a good night.
Good night, Mary Ellen.